Welcome to Knowledge on the Go, the podcast brought to you by Vizient's Performance Improvement Program. I'm LaTammy Marks, Senior Performance Improvement Program Director at Vizient, and your host for today's episode. Today, we're taking a closer look at the power of an accurate preference card. I'm thrilled to welcome Carol Zelenkowski, System Operations Manager for Surgical Services at Mainline Health in Pennsylvania.
Thank you for having me today.
Mainline Health was one of 33 organizations from the U.S. that participated in the Vizient Preference Card Management Collaborative to improve accuracy, practices, and processes. Carol played a central role in Mainline Health's preference card management journey. Carol, can you tell us about your preference card management journey prior to joining the collaborative?
We're a 4-hospital system comprised of 4 hospitals and 4 separate campuses. We had over 20,000 preference cards all told across all 4 campus surgical services departments. We've had the goal all along of trying to optimize these cards. The ultimate goal was towards standardization of cards. All 4 campuses had 4 distinct specialties within the surgical services department. The Vizient Collaborative was very helpful along our journey. The surgical services department is one of the key financial drivers for the health system. Like health systems throughout the country, we're contending with budget constraints, so we wanted to be good financial stewards as a department. So that's why we joined this collaborative.
Carol, what inspired Mainline Health to join the Preference Card Management Collaborative?
The Surgical Services Department is one of the key financial drivers for the Mainline Health System, and like many health systems throughout the country, contending with budget constraints, we wanted to be good financial stewards as a department. So participating in the collaborative, we wanted to know where we aligned among our peers as we set out with goals to optimize preference cards and move towards standardized preference card process. The collaborative helped to identify and promote what's working well, areas we can improve upon, and utilizing Vizient's best practices as a means to work toward our goal. Preference card optimization supports operational efficiencies, reduces cost, and provides cost savings.
So a successful strategy of the collaborative encouraged organizations to optimize their preference card library through either reducing, archiving, or inactivating preference cards that had not been used in 12 months or more. You were working with a huge volume of over 20,000 preference cards. How did your team decide which ones to prioritize first?
We collectively decided to focus on general surgery and GYN surgery. We utilized surgical log reports and usage reports and drilled down to the most routinely used procedures across all 4 campuses in the health system. We identified these as our basis of our focus for the collaborative.
As you started digging into the data, what stood out to you the most about variation? Was it cost or supply use between certain surgeons, procedures?
What was very interesting when we started digging into the data, we did see variations across the board, but what was most striking to us is that we found the lowest cost surgeon and surgeon preference card performed the highest volume in cases. And conversely, the highest cost surgeon performed the least amount of cases. When we presented this data to the physicians and the stakeholders, there was a collective buy-in for a more standardized and cost-effective preference card.
I like what you said about how you were able to quickly allow the data to guide you. Another impactful practice that came out of the collaborative was organizations were conducting one-on-one interviews with surgeons where teams would suggest recommendations or just simply provide education. How did your team approach sensitive conversations with surgeons, especially with suggesting a change in supply or retiring a preference card altogether?
We share the cost variation data with the system chiefs of surgery and our surgeon colleagues, which that alone sparked an interest and desire to be more cost effective among the group. By presenting the surgeons with accurate preference card data and accurate card content, secured more trust in the process and more support and more buy-in from the surgeon staff.
Opening up the lines of communication helped to drive effective change, would you say?
Yes. Most definitely, and buy-in from the surgeons. The Surgical Services Department in Mainline and all of our partners all strive for the same needs and the same goals in this. The initiatives of the project aligned with the broader strategic goals of our organization. key stakeholder support and senior and executive leadership support, along with the system chief of surgery and our surgeon partners, furthered by our trusting relationships and open communication on the lines of this project, assisted in garnering their support and their buy-in and their feedback.
You mentioned that you started out with over 20,000 preference cards across the 4 facilities. Tell me a little bit about the savings that you've yielded.
We took a 3-step approach towards optimizing the preference cards. First is reducing our total preference cards. So we reduced inactive and obsolete cards from our catalog. Secondly, we improved preference card efficiencies in terms of supply costs through routine card updates to ensure that the most accurate supply items and the most accurate cost of those supply items populated the preference cards. Lastly, we identified the greatest variations in cost per preference card and strategized ways to standardize. With the collaborative communication and efforts among all of our stakeholders, we identified procedures and preference cards for one campus, and that updated the procedure preference card for a total cost removal and cost savings of over $2,000.
So if you're looking at 20,000 cards, $2,000 on average per card, that really adds up.
Yes, it did. And we were able to reduce our total catalog of preference cards by over 12% within our participation in the collaborative.
Awesome. Where does Mainline Health go from here? What's next in your journey towards preference card optimization and standardization?
The success of the initial project has induced interest in other specialties in surgical services, in particular like our GYN surgeon partners. So in collaboration with the campus OBGYN chiefs and the staffs and OR leadership and the service line coordinators in each of those, they are actually embarking on building their own preference card optimization with the surgeon group themselves, based on our successes from cost containment and preference card optimization with the other specialty.
It's a testament of piloting one small area and then allowing it to spread to others. And that's the whole benefit we see our participants have in starting a short or a small project and then spreading it out. If another healthcare organization were just getting started on this journey, what advice would you give them based on what you've learned?
First, be inclusive and garner support from your senior leadership and buy-in from your stakeholders. Build trust and transparency with the physician partners and the stakeholders and reinforce those collaborative working relationships. This can then help establish, with the physicians especially, a sense of responsibility and a sense of ownership in the process as you work towards achieving your common goals. And also, throughout this, provide frequent updates to all involved. Work on the areas that need improvement, but most especially build upon your successes. In standardization, with the success of the initial project, it did induce interest from another specialty. We are utilizing more data-driven information also to help us along this journey. We do hope to be able to standardize preference cards in each one of our specialties.
It looks like Mainline Health has done a great job. I look forward to hearing about your continued progress. Carol, thank you so much for sharing your insights and experience with us today. My important question to you, our audience, is, do you know how many preference cards are currently in your preference card library? And have you implemented a preference card improvement plan to improve accuracy or reduce or archive your cards? If not, the time is now. Thank you again to Carol Zelenkowski for joining us today and sharing your insights. And thanks to you, all of our listeners, for taking time to join us as well. Please join us for more Knowledge on the Go podcast. You can subscribe today, like us, and send us your comments at picollaboratives@vizientinc.com. We encourage you to keep the conversation going. And as it continues, remember to put your knowledge into action. Until next time, I'm LaTammy Marks.